Hi, my name is Taylor Walk. I'm a speech language pathologist at Cole Pediatric Therapy in Humboldt, Texas, and I'm here with my coworker and friend.
Hi, I'm Caroline DaPra. I'm also a speech pathologist here at Cole Health in Humboldt.
Today, we're going to be talking about different factors involving autism and feeding. So there is an evidence and an overall consensus amongst researchers supporting an association between higher food selectivity or picky eating and autism spectrum disorders. Feeding problems occur in about 25% of all children and 80% of those with a developmental disorder. The estimated number of feeding problems in autistic kids has been reported to be as high as 90%. Body weight was below the 5th percentile in 20% of autism versus 9% of typically developing kids. 59% of autistic children who are undergoing an endoscopy, so the tube where it goes down your throat, for GI, gastrointestinal symptoms, had digestive abnormalities compared with only 11% in unaffected children with similar symptoms. So the first one that we're going to talk about is sensory factors. Feeding is one of the most sensory intensive activities that we do as humans, with the only other comparable fully encompassing sensory activity humans complete is the activity that causes you to have kids. Children with autism are significantly more likely to refuse foods based on texture and consistency, taste, smell, mixtures, brand, and shape compared to typically developing kids. Sensory hypervigilance. So whatever your child's personal icks are, they are extra aware of any possible sensory overloads or sensory hypervigilance, which causes the behaviors that halt that progress. So this is going to be secondary to like food presentations or like their own sensitivities internally. Taste is the second highest reason for refusal in autistic kids, but this is part of our genetic differences and not something that we can control. The autistic kids have a harder time controlling their reaction when they don't like the taste and are going to go to the extreme of completely avoiding foods. There are 3 different taster types, genetically speaking. There are non-tasters, which is about 25% of the population. And it doesn't mean that they don't taste anything. It just means that they're not super sensitive to the differences in taste. And it's because they have a low number of taste buds on the tongue. And they actually tend to like stronger flavors and they over-season food. There are medium tasters, which is the majority of the population at 50%. And they have the typical number of taste buds. They're your everyday average eater. And then there are super tasters, which is 25% of the population, and they have extra taste buds, making them ultra sensitive. So sugar is even sweeter, sodium is saltier, and bitterness is intolerable. So these are the usually where we can see some picky eaters based on taste. So the International Dysphagia Diet Standardization Initiative, or IDSI, is a way that therapists and speech pathologists use to describe textures universally everywhere. So that's at the hospital, here at your clinic, in another country. Every therapist should be aware of this pyramid and how they want to describe the food textures. So at the bottom, there's level 0, which is thin liquids. This is like water flowing easily. Then there's level 1, which is slightly thicker liquid. So think like whole milk, okay, super thick liquid. Then there's level 2, which is mildly thick liquid. So that's going to be like your heavy whipping cream. So still pourable, but definitely noticeably thicker. Level 3 is going to be like a drinkable yogurt, like those Go-Gurts, or even ones that you can kind of spoon, but it still kind of falls off and doesn't really hold a shape. Level 4 is an extremely thick puree. So this can be like actual purees or food that you puree yourself, and it's going to hold its shape. whenever you pick it up with a spoon. Level 5 are minced and moist foods. So those are kind of like wet breads or cakes or similar things. Level 6 are soft and bite-sized foods. So those can be drier, a bit more crumbly, but they're still super easy to bite into, not crunchy or anything. And then level 7 is like the biggest group of foods because it's all the other regular foods. So you can have a bunch of different textures within level 7. But that's always the goal, is to get everyone to get to level 7 foods. Next, we're going to talk about medical factors. So there are two types of gastrointestinal concerns. There's functional, which is related to behaviors, usually poor eating and toileting habits like extreme picky eating or ineffective bathroom routines. Then there's organic, which is related to the biological factors. So that's like an altered gut microbiome, altered movements of the digestive system. So your food's not traveling down like it's supposed to. And then there's also the increased risk of gluten sensitivity, lactose intolerance, allergies, and acid reflux. So nutrition deficits, which are organic, are associated with extreme picky eating, which is functional. So lower protein and potassium affects mood and muscle growth. Lower vitamin B12 and higher magnesium can affect neurological problems. And then the rest of the vitamins listed can affect your metabolism, bone, and brain health. So when we feel bad, we don't act like our usual selves. We're more grouchy and irritable, but we have words to express that and can regulate ourselves. Autistic kids don't have those abilities, so when they feel bad, their behaviors can and often will increase. So some of the organic things that can cause these behaviors are GERD, which is gastroesophageal reflux disease or acid reflux. So this is a digestive disease in which the stomach acid or bile irritates the food pipelining by moving backwards in the digestive tract. So research shows that GERD is the highest GI order correlated with food refusal. The next one is eosinophilic esophagitis. So this is actually a chronic allergy inflammatory disorder manifesting itself predominantly in reflux type symptoms that do not respond to standard anti-reflux medicine. And then the last one, allergies. So this is a result from the overreaction of the immune system to typically harmless proteins in food. So they manifest as a variety of symptoms ranging from the itching, redness, and swelling, vomiting, diarrhea, to difficulty breathing and other potentially life-threatening symptoms. But some people who test positive on skin prick allergy tests don't notice any allergy-related symptoms when they eat the allergen, or sometimes they show up days later. This condition is sometimes referred to as asymptomatic sensitization. However, research indicates that there may be a link towards brain and or stomach inflammation caused by allergies and behavioral problems. So this area is still being studied. Next, we're going to do our motor or our movement factors. Motor and sensory skills cannot develop independently of one another, making feeding a more complicated task as it requires both to be developed. Unfortunately, we cannot change the foods going into the mouth and stomach without actually touching the mouth. There are deficits that develop due to avoidance and not having the opportunity to engage in consistent oral sensory motor activities or feeding. And these are experience-based deficits, so they are secondary to medical complications like autism, who have an otherwise intact motor system. But these are deficits that tend to change more easily once we introduce the motor task in therapy, versus motor deficits that kids can have from birth. Gagging. So due to the early aversion, so like when kids don't open their mouth when like they're presented to a spoon, and then other oral motor delays, this gagging makes it is what happens because it makes it difficult for the brain to process how to eat different textures when they have those oral aversions. So the smooth muscle, which are the muscles used for swallowing, doesn't strengthen ever. It changes with stretch memory. So if an incoming material is perceived as stretching too much too fast, so a new food is the incoming material, the brainstem is going to activate the vagal nerve response, which is an immediate gag reflex. Okay, so this is an automatic response and not under cognitive control. So the kids aren't being dramatic. This is their brain is literally telling them that this is too much right now, and they're gagging in response. By following this order of increasing the quantity before the variety, and then increasing the variety before the texture, we are slowly stretching the smooth muscle to decrease the gag reflex. So some common motor deficits that you might notice with picky eaters is they don't use a rotary or a circle chew. So this is the adult chew that we all use to rotate our jaw. They'll only use a munch or an up and down chew. They don't move their tongue side to side inside their mouth to form the bolus, the food that you end up swallowing. And this will cause food residue to stay on the sides of the mouth and on the top because they're only moving their tongue forward and backward. Unrhythmic chewing, so this can just cause more issues forming that bolus. And then they can also pocket or hold food in their cheeks because they're not moving their tongue around in their mouth, and that can be a choking hazard because if it's in their cheeks and all of a sudden they fall down, the food's going to move and it's going to go to the back of their throat, and all of a sudden they might be choking. Next, we're going to talk about behavioral factors with Caroline.
Okay, so behaviors. These are some of the most frequent behaviors that we see here in the clinic. I'm sure at home there are more that y'all see. These are just the most common ones. So anything that they're doing to indicate that they are not wanting to eat, whether it's pushing away the food, turning their head away, crying, screaming, hitting, whatever it may be, that is some way of communicating that they don't want to eat, therefore resulting in this behavior. So why do these behaviors occur? It's important to remember that all behavior is communication. Whether your child speaks, whether they're speaking or non-speaking, they're still going to use behaviors to communicate their feelings, as we do. Think about when you smile, when you're happy. It's not always saying something in order to indicate what they want. Usually, majority of the time, there's some type of difficulty the child has to make the task difficult. And difficult things aren't fun to do. Therefore, they're not going to want to do it, and they're going to result in these behaviors. Also, think about some of the things that Taylor just talked about. There's going to be some type of deficit in one of those things that is going to result in them not wanting to eat. Also, consider sensory challenges that your child may encounter on a day-to-day basis. As Taylor said before, eating is one of the only things that we do that incorporates all of our senses at the same time. And also consider that they may have some difficulties understanding language or using language to communicate. It's important to search for the reason for this kind of behavior. It's easier said than done, as there's a million different things it could be. But one way that you can help is writing down, okay, I presented this type of food to my child and this was their reaction. And then giving that to your speech therapist, that can really help as well. Eating is a learned skill. It's not something that just comes natural to us. When we're born, we have these reflexes that happen, but as we get older, we have to learn through watching other people. Behaviors, as in the previous slide, those can also be learned too, if we are supporting them or reinforcing them. Oops, sorry. So, learning to eat and learning not to eat. So this is a chart that kind of goes over the different types of reinforcement and punishments. So for positive reinforcement, we are adding something to increase the behavior. So your child eats, then you give them a lot of attention, a lot of praise. Good job. I like how you did that. I like how you ate. the spoon from the spoon, things like that. That's going to result in more eating. However, for negative reinforcement, your child's refusing to eat, they're showing you all these behaviors, and you take away the food, you're removing the stimulus, that's going to result in less eating. They're going to think, oh, I just threw a fit and it worked, so I'm gonna keep doing that so I don't have to eat. As well as with punishments, so for positive punishment, you're adding something, but it's decreasing the behavior. So for example, your child is eating, but you yell at them because they're not eating enough or they're not eating fast enough. That is going to result in the child eating less. For negative punishment, you are removing something to decrease the behavior. So your child's refusing to eat, they're showing all these behaviors. You say, okay, well, if we're not going to eat, then we're not going to we're not going to get to have ice cream after dinner. That's going to result in less refusal. So positive reinforcement can increase undesired behaviors as well as desired behaviors. If a child's reaction to reinforcement is negative, research shows that their appetite can be suppressed. So meaning that they're not going to be hungry if they're upset. So really consider what is the goal behavior? What do you want your child to do? And how can you help them learn how to eat? So some ways to increase wanted behaviors, to offer choices at meals, whether it's between, okay, do you want the blue spoon or the purple spoon? Or do you want to eat the apple first or the carrot first? Giving them choices allows for a sense of control, which everybody craves, especially kids when they don't have much control. Encourage them to feed themselves, and make the expectations clear. So I have a couple examples of visual schedules. So this right here is a visual schedule. It's okay. You say, okay, first we're going to eat, then we get the ball. Or there's other examples down here. There's cars, slide, but making them be able to see it. So if they're not understanding the language that you're using, they're getting a visual as well. Also, the timer. This timer is for minutes, but you could get one with seconds as well. Okay, we're going to eat for this long. And then after that, we get this, for example. It's going to beep, I'm sorry. Allow play with food. So messy play, pretend play. Playing with the food is an important process of learning about the food before we eat it. So touching it, feeling what the texture is like, smelling it, getting that different kind of input to really determine what it's like before actually eating it. That's a very important step. Encourage internal motivation. So reward levels will need to be adjusted for each child, especially as they develop and they get more successful or they get older. A ball may not be as motivating as it was when he was 5. Now he's 10 and that's just not cutting anymore. So encouraging that internal motivation so that they want to do it for themselves, and create that independence. Maintaining a calm state. So if you stay calm, your child's going to stay calm. Again, the research says that if they have negative feelings or they're upset, sad, that can suppress their appetite, and that's not going to lead to more eating. So really try to model good, calm vibes. And always seek to create connection. Meal times are normally a very social thing, and everybody wants to feel understood and that they're seen. So try to create that good mentality for times. Ways to decrease unwanted behaviors is to redirect the child back to the task and ignore the negative behavior. I can't stress that enough, to ignore it. If you pay more attention to it, they're going to think, oh, I'm getting a reaction out of you, I'm going to keep doing this. But if you focus on the food and not the behavior, that's going to shift their mindset a little bit. Another thing is to model desired behavior. So really overemphasize chewing, exaggerate your swallows. Kids are always watching, and that's how they're learning. So be sure to be a good role model for your child. Don't force feed. We can normally tell when a child has been force fed, when they come in. That's going to create a negative feeling towards feeding. So getting them to interact with the foods first before getting them to eat it is really important. present a variety of foods to interact with, not just preferred foods. So that way they have choices again to what they're wanting to touch first. Remove distractions from when you're eating. Really focus on the food. So sorry, in here. Also, don't bribe, threat, or persuade them. Again, going into that internal motivation. So some reasonable requests. Reasonable requests means lowering the expectation of the task to a level that's achievable for the child, but not removing the task. So persistence to consume food, sorry, and allowing escape of the behavior is going to result in them crying, eloping, all those things. But removing it is going to let them continue to do that, and it's not going to get them to eat. We don't want to allow the escape from the food. Sorry, let me start that over. We don't want to allow escape from the request by removing the spoon or the tool with increased behaviors, because once we remove that, they're again with that negative reinforcement, they're going to think, oh, that worked, I don't have to do this again. The tool or the spoon or the food should remain at the table until the task is completed, even if you have to help them. Recognize that the demand may be too great or unreasonable for the child. So decreasing the demand, so changing it up a little bit in order to get them to participate or complete a task. Instead of licking the food, we can pick it up with our fingers and try it again. Take your time and move slowly. It's not going to happen overnight. Keep the routine. Keeping a consistent schedule is more important than how much they eat. Think about when you're practicing a sport or exercising. If you do it one time really, really hard, it's really not going to help over time. But if you practice every single day, little by little, you're going to get better. They're going to be able to learn more. So keep a routine so that the child knows what to expect at every single meal. Again, you can create something like this, a visual schedule, like for dinner, we're having this, this, and this. Prep your child. Get them saying, okay, we're going to wash our hands. Then we're going to go to the table. Let them have as much awareness ahead of time, because fear and anxiety and autism, kids with autism, all need a routine to remain the same in order to decrease anxiety and fear. I'm sure y'all are already aware of that, but routine is key. Also, you can give 20 to 30-second breaks between tasks in order to help or motivate them to continue on. Also keep the structure. We want everything to be the same to allow for some breathing room for the different foods. When everything else is different, kids are more likely to want their comfort foods. So keep the room the same, the setup the same chair, the same tools, the same environment. We're gonna have all our meals at the dinner table. There's gonna be no distractions, no iPad, no things like that. It's all gonna be the same. Use the same commands to signal the tasks after each meal or at each meal. So you can say, smell it, time to chew, my turn, your turn, things like that. And use labeled praise. So good job chewing, good job touching, good job tasting. We want to provide specific feedback. So instead of saying just good job, say something about the actual behavior that is happening. So for example, good job chewing. I like how you used your finger to touch the pudding, things like that. Also use neutral language, which can be difficult to do at times, but we want to avoid things such as eat this so you can be big and strong, or wow, this is so yummy. Instead, say things like the jelly is sticky, it looks purple, the pretzel is bumpy and crunchy. Describing the foods really helps with that. And give praise for all interactions with foods, whether they're touching it, smelling it, tasting it, anything that they're doing that they weren't doing before, take it as a victory. Okay, and so to sum it all up with the behaviors, regulation. So regulation, the definition is something that is controlled or maintained or something to control or maintain the rate of speed a machine or process, aka your body, so that it operates properly. So this is our cup. This is our sensory regulation. Try to do this so it's not everywhere. When it's full, you're regulated, you're calm, you're maintained. When it's empty, you need something in order to get it back up to being full. So you'll need sensory input like squeezes, jumps, any kind of activity that is a lot of gets a lot of sensory input. That's what you need in order to fill it back up. So you did your jumping jacks, you got some hugs, you're good. But when it's overflowing, that's when you're dysregulated. And that's when these behaviors happen. So you know your child best. Don't push it. If they're already having a dysregulated time, you're the expert of your child. If they're about to spill over, don't push it. And now we're going to go into social factors with Taylor.
Okay, so if you've been with us this long, thank you. This is our last section. So eating in public. So taking kids out of their preferred environment increases their stress level. So just like what Caroline was talking about with their regulation. So going somewhere else that they're not comfortable at is going to like really push their limits on their cup. Okay, and there's a big chance of overflowing. So with the increased stress level, they're going to be less likely to accept food, even their regularly preferred food. So at restaurants, you're going to help them regulate in other ways. So make sure that they're wearing super comfortable clothes and shoes, headphones if needed, fidget toys. So, and the fidget toys are only to be used when you're out, not in routine at home, because there should be no toys at the dinner table when you're at home in your structured routine. And then at school, warn the teacher that they might not eat. See if it's possible if they can eat alone with less distractions. Try to get the school, if possible, to emulate what you're doing at home as much as possible to help the kid have the same structure. And then last thing, family meal times. So children do better with their eating and being exposed to new and unfamiliar foods when someone talks about the foods and describes them, describes what the food are like. So just like what Caroline was saying with the neutral language. So this doesn't need to happen all the time, but anytime a new food is introduced or like you see them looking at something, you can talk about it. Like those are orange sections, they have juice inside, and when I chew on it, the juice squirts inside my mouth. Or when you're eating it, you can tell your child what you're doing. Eating should be a routine. Nothing extra should be given or taken away based on what the child does and does not eat. We want to just work on the behaviors regarding the mealtime. So the meals and snacks should always be offered when others are eating because eating is a social activity and it's also a very good way to model appropriate behaviors with the food and then try to do it with the same food. So even if they have less of the non-preferred food on their plate as you do, they at least have a spoonful on it so that way it still mimics what you have. And then just don't pressure your child to eat with bribes or punishments. So if you have want to look into anything that we talked about, here are our resources that we use for this presentation. Thank you so much for listening. Here is our contact information if you have any further questions or comments and want to reach out and talk to us about what we talked today. If we don't know the answer, we will find the answer or direct you to the best possible person. I hope that this was helpful and that you're able to implement it at home.
Thank you.